Hello everyone and welcome to today's live seminar. Whether you're joining us from the United States, Canada, or elsewhere in the world, we're so glad to have you here. Our mission is simple: to help patients like you explore safe, high-quality medical options abroad. And today's conversation is one I'm especially excited about. When most of us think of brain or spine surgery, we imagine something distant, intimidating, maybe even a little frightening. But what if you could hear directly from a neurosurgeon whose work focuses not only on the complexity of the operating room, but also on guiding patients through their entire journey, before, during, and after surgery? That's what today is about. For many of our patients in the United States, the reality is high costs and overwhelming medical bills, while in Canada and other countries, it can be the long waiting lists. Either way, it leaves many people searching for safe, reliable options abroad. And in neurosurgery especially, trust and expertise are everything. That's why I'm so excited for you to meet today's guest. We're joined today by Dr. Enrique Villarreal Garcia, a board-certified neurosurgeon specializing in complex brain surgery. Dr. Villarreal completed his medical degree at the Universidad Autónoma de Nuevo León and went on to complete his neurosurgery residency at the Universidad Nacional Autónoma de México. But what really stands out is his international training. He has completed advanced rotations in vascular neurosurgery at the Universidad of São Paulo in Brazil, skull-based surgery in Argentina, and endoscopic endonasal surgery in Naples, Italy, under the mentorship of some of the most respected neurosurgeons in the world. He also completed a prestigious fellowship in skull-based surgery at the Instituto Latinoamericano de Neurociencias. Dr. Villarreal is an active member of leading global organizations, including AO Spine and the American Association of Neurological Surgeons. And he has presented his work at international congresses in Miami, Bogota, and beyond. Above all, his focus is on bringing world-class neurosurgical care to patients here in Mexico, with an approach that emphasizes precision, safety, and patient-centered care. Dr. Villarreal, welcome. It's a real pleasure to have you with us today.
Thank you for the invitation.
So we'd like to start out hearing about your origins.
Mm-hmm.
Can you tell us briefly what motivated you to specialize in brain surgery?
Well, between brain surgery and spine surgery, you will find one of the most common causes of pain. So you will see people around you suffering from some illness that may look impossible to heal. But if you take a good care of those kind of people, you will realize that you can help in a big way. Like sometimes you will find people in a wheelchair and you can find the reason why they cannot walk. You can help them walking again. It could sound something like science fiction, but deeply, when you study someone, you can always find the reason. And if you find the real reason, then you can provide a good treatment and a specialized treatment. If it's about the brain, you can have a good treatment, something about a tumor, something about a hematoma. And if you have something about spine surgery, well, most common causes of spine surgery is herniated disc. So you just need to take a good look in the people.
That's great. Can you explain to our audience, when is spine surgery recommended for patients?
Well, actually, sometimes people believe like we are just looking to make surgery on them just because. But you need to realize that spine surgery always only stays in the less people, and it's the less causes when you get into surgery. Like, if you find an herniated disc, it's not the meaning that you need to have surgery. First, you need to try with medication, physiotherapy, or just stay calm. Only the less percentage of people with herniated disc get into spine surgery. So that's why it's so effective, because you only make surgery in the people who need it.
And what are the most common cases or conditions that you treat as a spine surgeon?
Well, the most common condition is about herniated disc, something about instability of the spine, like spine tumors. Well, those are the first causes, causing something like sciatic pain. And we're talking about real pain, because if you heard the structure in charge of telling you what is pain, so that's the pure pain you will experience. So yes, herniated disc and spine contusions and tumors are the most common causes of the spine surgery.
Oh, I'd never heard it described like that. It's impressive. How do you decide if a patient needs surgery? You've mentioned you use surgery maybe as a last resort. So how do you decide if a patient needs it and can be managed without it?
Okay, yes, it's always our last resource. Never will look about a patient always thinking about the surgery. Never. It's always our last resource. Why? Because we always need to prevail the anatomy, the original anatomy of the patient. Well, we always try to get some stages before the surgery, like first medication, first stop making exercise, the most common stuff in the world. So if without medication, without resting, you don't get better, maybe we will try with some physiotherapy if it's in the case needed. And it's not, then we can start thinking about surgery. But before thinking about that, we always need to make a good image studies, blood labs. So it's not like the common idea that every spine disease will need surgery. Even most of these diseases will heal without the surgery. But that's why we need to make a complete test of the patient. Yeah.
That's great to know. I'd like to speak a little bit about advances in modern techniques.
Yes.
We hear a lot about minimally invasive surgery.
Sure.
So what does that mean, and what are its main benefits?
Okay, well, surgery has become even more and more specific for each disease. So in the beginning of spine surgery, it was really drastic, because you used to make a huge surgery, taking you months to recover from this. So now it takes us something about 40 minutes to make surgery. At the next day you will go home only walking by your own. So about minimal invasive spine surgery, it's about making the less harm to get the best of the patient. So it's about putting some endoscopic lens, getting into the specific disease and make it better. It's not anymore about taking a look about everything in the back and maybe this and maybe that. No. It's not anymore like that. You always look the disease, the specific disease, and you will take care of that. That's why it's getting even better now, because between surgery and going home, it takes you 24 hours the most. So, and maybe it will get you confused about this, because when you look at somebody MRI, you will find that you can have 10, 5, 4 herniated discs, but that does not mean that you need to take care of all of the herniated discs. You will take care of the specific herniated disc that is making the sciatic pain. Mm-hmm. So that's about the minimal invasive spine surgery.
And when we talk about technology nowadays, everything from robotic assisted surgery to 3D navigation, how has that changed outcomes for patients?
Well, the technology every day is getting better and better and better. So I don't know, maybe in the future we will have robots taking care of us. But meanwhile, the robots are helping us to make the things better. So that's why the surgeries gets even faster than before. So we always need to be side by side with technology. We always need to investigate, study, so we won't get behind the technology. Always side by side.
And can you share an example of how these advances have improved patient outcomes?
Yeah, sure. Like when we are making some spine surgery, we can have a reconstruction of the spine. We can take a three-dimensional reconstruction, and to know where exactly we are going to look at the spine. Sometimes we can make only a small incision, about something like 0.8 millimeters, that is the side of the lens. But before, we need to take care of the nerves on the legs. That's why we use something about monitorization of the legs. So when we are getting closest to the nerve structures, we always know if we are gonna be close to almost hurt something, so we stop. So we have 3D reconstruction, we have monitorization of the nerve system, we have always live image when we are in the surgery. So that's what I'm talking about, be side by side with technology.
Right. Yeah. Now, we receive messages from patients that reach out with certain fears that maybe spine surgery will either impact their mobility or they might end up even worse than before. So how do you respond to these concerns?
Well, and they're right. At the beginning of time of spine surgery, they create the misconception that is a dangerous surgery. But no, not anymore. We call something about safe surgery, because as we said before, we are side by side with technology, because we have a monitorization of the nerves system. So that way we know we are making a better of the nerve system while we're doing the surgery. So at the end of the surgery, of the 40 minutes of surgery, we know the percentage that it's getting better. Something like, well, we made surgery on you and you got 40% of recovery instantly while we were making the surgery. So, and we have the studies and we have the monitorization to have to stand for that. So no, those days when everyone was scared of spine surgery are on the past. Right now I think it's even safer than any other surgery in the world. So you don't need to worry about that misconception of the harming of spine surgery. Not anymore. That's on the past.
And yet, surgeries always entail a level of risk, right? So how do you assess or address the associated risks that come along with spine surgery?
Sure. Well, when you are doing surgery, spine surgery, it's not only about the spine. You always need to take care about everything else.
Right.
So that's why we are not working by ourselves. We have internal medicine helping us. We have the labs helping us. We have the imaging studies helping us. So before surgery, we know for sure that we are going to have success. That's why we always have a plan. That's why we always have a plan A or a plan B. But we know for sure that we are going through success. If we have any doubt about surgery, we need to reconsider everything about it. So, no. It's always a plan about surgery, and we are going always through success. Not like Miss walking and just looking around what we found. No. We always have a plan, and if we have the minimal chance of not being completely sure of what is going to happen, we will stop. So you can be calm about that. We will do the best of it.
And can you talk a little bit about what recovery looks like for a patient after spine surgery?
Sure. Well, when you get this kind of surgery, it's because you have a condition that won't let you do what you want to do in the future. So if you have a huge sciatic pain, it looks something like magic, but immediately after surgery, you won't feel the pain anymore. So that's what I'm talking about, always having a plan and knowing what is going to happen.
We'd like to talk a bit about the future, right? From your experience, how does spine surgery change a patient's quality of life, and how do you envision this specialty, clinical specialty, moving forward?
Well, we talked a lot about quality of life. Like if you are 40 years old and you have a huge back pain, sometimes you can think, well, I have 40, I can still manage this and get surgery until 60 years old. But what about those 20 years? Why would you lose that quality of life, the 20 years? Because then you will lose the chance of be with your son, with your children, be with your parents, walking around the world, because there's nothing more exceptional than walking around. It's completely free. You don't need to pay for anything. So that's about quality of life, doing the things you want to do now. You don't need to wait about 1 year, 2 years, or maybe in the future. If you need surgery, why not doing this in this moment? Why would you wait suffering so many years if you can stop this pain for the rest of your life? So quality of life, that's the concept you need to stick in your mind. You can live without pain. You did not came to this world to suffer. You came to this world to walk.
That's a great thought. And can you tell us a bit about your vision for the future of neurosurgery and spine surgery?
Well, it's the most common kind of surgery in the world, because everyone will have back pain in one moment of your life. So we are trying to specialize neurosurgeons in spine surgery and to provide a good quality, a good treatment among the world. Maybe it seems something impossible to do, but it's not. You will find some like in some specific moment in a specific city in the world that will enlighten the world. It's something like literature. You will find Shakespeare, you will find Cortázar, you will find Garcia Marquez, you will find Cervantes. Well, I think we could be that will enlighten the cities around to make things better, to make surgery safer and to help the people the better.
That's a great thought, thank you. And finally, what message would you give patients that are living with chronic back pain and are afraid of surgery?
Don't be afraid of this. Nowadays, living with pain is not an option. You need to have a good quality of life. Stop thinking about you could be worse. No, there's nothing worse than not be able to do what you want to do. You must be free of having the choice of doing anything. So right now, surgery, we are at the peak as a human about surgery.
Mm-hmm.
So you will be okay, you will be safe, and we will take care of you.
Thank you, doctor. This has been incredibly insightful. And for those of you watching from the US, Canada, or abroad, let's talk for a moment about the bigger picture. Traveling to another country for surgery can feel like a big leap, but that's where Traveler comes in. From your very first call, we take care of all the logistics, matching you with the right doctor, coordinating your flights, arranging airport pickup, booking your hotel close to the hospital, and even providing a personal concierge to support you during your stay. Patients often tell us they're surprised at how easy the process feels once they arrive, and most importantly, how reassured they feel knowing they're in the hands of a board-certified surgeon like Dr. Villarreal. So, Doctor, thank you so much for your time today and for joining us, sharing your knowledge, your experience, and your thoughts. It's been great for us and for our audience as well.
Oh, thanks for the invitation, and I hope see you around.
Thanks. And to everyone watching, whether you're just starting to explore your options or you're ready to take the next step, remember, you don't have to navigate this alone. At Traveler, our mission is to connect you with the world's best physicians in a way that's safe, seamless, and designed entirely around you. So if you're ready to learn more, reach out to us today. Our team is standing by to answer your questions, schedule a consultation, and help you feel confident about your care. Thank you again for being with us, and we hope to welcome you soon here at Neurospine Hospital in Querétaro.